Hi, I am Dr. Abrar. I'm a consultant at the Department of Neonatology and Paediatrics. And today we have Dr. Paras, is the lead consultant neonatologist at SPARSH Women and Children Hospital, Infantry Road, Bangalore. So what are the advantages of exclusive breastfeeding during the first 6 months of life? And do you recommend any artificial feeding or artificial methods of feeding a baby?
The most advantageous for the baby is exclusive breastfeeding for first 6 months. See, there's a lot of myth among the mothers that my milk supply is low. Let me tell you, it's a human physiology which makes your body ready for breastfeeding as well, or lactation after you deliver. So if you have delivered a baby, your body has to produce milk. So there is no other reason why your body should not produce milk. So just to understand the physiology, how it works is, so when the baby suckles on the mother's body actually calculates the requirement of the baby and produces milk accordingly. So if you look at it, the composition of breast milk also changes with time. See, babies are born with very less immunity. That's why first 48 hours, what mothers secrete is not actually the breast milk. They secrete colostrum. And by 2 weeks, they start producing mature milk. So this mature milk quantification happens so precisely that mother exactly produces milk what her baby requires. So this is a part of the bonding between the baby and the mother. One thing. And second thing, the customization happens in terms of all. If you look at it, breast milk contains tryptophan and melatonin in the breast milk which comes in the night, which helps the baby to sleep in the night.
True.
Let's say if the baby is born preterm, the mother's milk is always rich in more of protein to support the growth of the baby. So artificial feeding, why it is not recommended? As much as possible, it's better. We need to avoid it because exclusive breastfeeding has multiple advantages or numerous advantages. Yes, having said that, sometimes if the situation is not favoring, we do recommend artificial feeding with a formula. It has to be very case-to-case basis and encourage breastfeeding at all modes of lactation. Coming to how to feed. Ideally, bottle feeding or using a pacifiers are never recommended. These act as a source of infections. They cause repeated ear infections, repeated coughs and colds, repeated tummy infections in the baby, especially in the form of loose stools, vomiting. So I feel plastics as much as possible can be avoided. If the baby requires it, we can always look at using katori spoon or a pallada, which is always safe option.
Yes, sure. Thank you.